Thanks for staying with us. Health practitioners have been urged to address the state's decline in health indices following its performance in the 2024 Nigeria Demographic and Health Survey. Niger State Commissioner for Health, Dr. Muhammad Mursala Bagana, disclosed this when he paid a familiarization visit to the Medical and Health Workers Union of Nigeria, Niger State Council. NSTV correspondent Habiba Dauda tells us more.
During his presentation, Dr. Muhammad Bagana expressed concern that the figures placed the state below the national average, describing the outcome as a setback when compared with the 2018 NDHS, and attributed the situation to gaps in implementation rather than a lack of plans, and urged health professionals to recommit to their responsibilities under the new Niger Health Agenda, which aims to strengthen existing policies.
For me, this is truly overwhelming. I came not for a familiarization visit. This is like a home, and the way I was received truly shows that it was a homecoming. I'm quite delighted, and for us in the medical profession and in the Ministry of Health, we consider ourselves as Team Health. Today, the Medical and the Health Workers Union of Nigeria, Niger State chapter, has truly demonstrated that we are one, and entirely we are going to work together to change the narrative when it comes to the healthcare indices of Niger State.
He explained that under the new Niger Health Agenda, he is not introducing new policies but focusing on strengthening the implementation of existing ones, adding that his priority is to see tangible improvements in the health sector through collective efforts, unity, and teamwork among all stakeholders. In their separate remarks, the Permanent Secretary, Niger State Primary Healthcare Development Agency, Dr. Muhammad Ghana, and that of the Ministry of Health, Dr. Abdullahi thanked the union for hosting the delegation and commended innovative contributions to the sector, and urged the union to continue advocating for quality training, appropriate curricula, improved managerial capacity, and strengthening service delivery. Responding, the chairman of Medical and Health Workers Union, Niger State Council, Comrade Usman Abubakar Daban, expressed optimism that Dr. Bagana's leadership would bring positive changes to the sector, and highlighted some challenges facing the sector, especially the primary healthcare system, including inadequate vehicles and logistics for monitoring and evaluation, lack of transport for vaccines and commodities, interference by local government chairmen in promotions, shortage of skilled health workers, unqualified private schools of health technology, and the need for upward review of retirement age for health workers.
Maybe before I responded, the ED of Primary Healthcare Development Agency has responded. And he responded by saying, if we are talking of volunteers, of course volunteers are being paid. None of them is working for free. And in as much as they are not working for free, other health workers felt that they are also taking salary and they are also taking salary. And it is because there is insufficient, adequate number of health workers in the local government. So we need these volunteers to also augment the existing one. So we are also appealing to the government to look into this issue of employment. Of course, His Excellency Umar Mohamed Bago has tried in the secondary healthcare facility. But of course, the local government primary healthcare needed to also be looked into. If you look at the statistics now, on a monthly basis, we have exit of health workers, skilled health workers, sometime between 20, 25, 30, 35 on a monthly basis. So consider, even if you have 20 in a month times 12 in a year, how much do you have? So they should also think of how to also augment such gesture to the local government.
Highlights of the courtesy visits was goodwill messages and presentation of roll-up banner photo, frame and plaque to the Honorable Commissioner, and as well as a roll-up banner to the newly appointed Executive Director of the Niger State Primary Healthcare Development Agency, Dr. Inua Junaidu, and group photograph. In Mina, Habiba Dauda reporting for NSTV News.